Hey, thank you for joining us for an episode of the Medicine Mentors, where we interview leading physicians on the best tips, lessons, and pathways to mastery for aspiring physicians. Our mission is to learn from top mentors the most effective paths to mastery and fulfillment in medicine and to spread their knowledge. Today we have the honor of sharing our interview with Dr. Clifford Hudis, the Chief Executive Officer of the American Society of Clinical Oncology. Dr. Hudis is indeed remarkably intelligent and strategically wise in his leadership roles, but he's also kind, generous, and relatable. It was a pleasure to hear Dr. Hudis' wisdom on articulating a clear and focused vision, allowing passion to emerge and guide you, and always keeping the patient at the center of the work. Thank you for joining us, and please do enjoy this gift of knowledge from Dr. Hudis. You've had a lot of success throughout your career, Dr. Hudis. What characteristics do you think helped you get there?
The most important thing in my career is really good luck. A lot of people simplify this and talk about showing up being the most important thing, perseverance, grinding away day by day. And I don't want to make light of any of those cliches, but I do think that that's actually the truth. On any given day, it wasn't about any lofty, long-term ambition necessarily. What I always did was showed up and did the best work that I could for the time and situation. I do think it's worth saying that when you expose yourself in that way, then you're often allowing good things to happen. And in my case, it was certainly the opportunity to meet leaders in the field, leaders who could both inspire and offer very specific guidance and direction at each stage of my career. And I think that's been the core of my good luck.
What are some of the things that these leaders, these mentors have told you that you think have made a difference to the way that your career has progressed?
Well, I think that it goes in a few different directions, and they're not mutually exclusive. But among the things that I learned was certainly in medicine to focus on the patient. Always put the patient at the center of everything we're thinking about and first. And that then ripples out. That means that the patient and their needs, their care really does take priority. That means that the kind of research we do should have a clear path to changing patient care for the better, and so on. In a sense, that's been the North Star for me, and I've learned that over and over again from many different people. Now, I want to say, there are clearly many other ways to success in science, even in healthcare, for different kinds of careers. But for me, that was the North Star.
In your presidential address for ASCO a couple of years ago, you really emphasized the point about the power of intention. What do you mean by that, and where does that come from?
A very basic issue in leadership, in business, in science, is knowing where you want to go. I do think that there are many, many structures in place for many of us that could allow us, in some cases, to go through our days and our weeks, months and years, dealing with any number of important but small matters and not necessarily knowing what the goal was. There's always a balance here, so I'm not suggesting it's all one thing or the other. But what I care very much about, whether we're talking about healthcare and its reform in the United States, whether we're talking about the system for things like drug pricing, whether we're talking about even the discussion we're having about burnout and the lives of professionals, is I think we have to have an intention. I think we have to declare where it is we're trying to go, even if we have to change that and make adjustments along the way. That very specific clarity of vision is what I think is so important. By the way, I think it generally exists. I don't think it's generally communicated in especially big systems. It is very easy for leadership or executives of organizations to know very clearly where they want to go. It is common for the rank and file to not necessarily be on the same page. So intention for me was both about knowing where I want to go and sharing it.
Can you share a few examples from your personal life, a concept, the belief in the power of intention has helped you along your career?
Certainly in the last few years since I became CEO of ASCO, this has become for me even clearer. So at ASCO, which is a large professional society with nearly 500 employees, multiple offices, many programs, many, many departments, our intention fundamentally, it's easy to say, is to drive higher quality care for patients, ultimately. But at a slightly lower level, there were lots of programs, some highly effective, some less so, some well coordinated, some less so. And I saw with staff leadership that getting this organized was an important next step in the maturation and growth and thriving for this organization. And so declaring our intention at ASCO for me became central to my role as CEO. And of course, what people who are in this leadership world would know is that means a strategic plan. And for me, what I have done since I've gotten to ASCO is work with all of the staff to derive a well, I hope, communicated and shared multi-stakeholder input strategic plan that calls out what we're trying to do. That is, what is our intention?
As residents seeing patients on a day-to-day basis, how can we apply this to the hospital, to our patients?
The idea of intention.
The idea of intention, yes.
Well, I think that that's really, in a sense, the hard question and the organizing principle for so many of us in our careers. If my goal was personally to interact with patients every day and help them navigate the difficult terrain in the case of cancer of a diagnosis, fear of recurrence, treatment of active disease, and all of that along with their families, then my intention might be to establish and run a highly efficient, patient-centric clinical practice in a neighborhood or an area geographically that needs my services. That is a great mission, it's a great vision, it's a great intention, and the tools are there to fulfill that. You could have a different aspiration that serves the same general ideas as perhaps I and others have had, which led me to my current role. I think what is common or shared is none of us should just float along in the river here, seeing what we bump into. Even if we're on the wrong path, I think it's important to know what we're working for and then make adjustments in that as we learn more.
So to have the clarity of vision, the clarity of intention, and where we want to go, and then modulate accordingly.
Late in life, not at the beginning, I have become a zealot for strategic planning. And that's what this ultimately is, both personally and institutionally or organizationally. It allows us to determine how we're doing. I'll tell you a small story which explains why I feel so strongly about this. When I took this current job, I had a lot to learn. The structure of most nonprofits is thus. There is a board of directors, elected or chosen in some way. They make usually a single hiring and firing decision. Their chief executive, that could be an executive VP, general manager, CEO, it doesn't matter what the title is. And then that board sets the vision, the intention for the organization, and measures the CEO in her or his delivery against that goal. To do that, you have to say in plain English what it is you're trying to do. You can't hold somebody accountable for vague notions of success. You have to declare what it is. And so as I stepped into this role, the necessity for that kind of clarity became clear to me, probably for the first time at this level, at this granularity in my life. I'm sure it was there before, and I'm certain that others around me had this clarity, but I perhaps did not.
Another thing that you mentioned to me was to follow your passion and how critical that is to achieving success. Could you take us through this and how this has made a difference to your life?
I think this is an interesting question because I think it's a little bit like there are these studies on smiling. This is going to sound like a non sequitur, but bear with me. That if you smile, if you just will yourself to smile, then in fact you have a better day than if you don't. So the parallel is willing yourself to passion. And what I mean is, when I was an intern, not knowing remotely the course that my career would take, I was certainly passionate about doing the best job I could, taking the best care of patients. And honestly, as hard as that internship was, and this was in the pre-modern era when we stayed up all night, every third night, and so on, and there were no computers and it was all manual. If you asked me at the time, I would have said internship was hard but fun. And, you know, a lot of people say, well, certainly don't say fun when they're talking about internship, but that's how I felt. Residency for me was fun. Fellowship was fun. And what I think is interesting about this is either I'm deluded or I have managed to make or develop passion around each of those steps. Or maybe another way to say it is I allowed myself to feel passionate about each of those steps. And if you can't find that passion for the thing you're doing, maybe you're really not doing the right thing for you in your life. And that's a little bit backwards than saying follow your passion. I get that. It's really allow your passion to emerge. But maybe the deeper way to think about that is if you really can't find passion for that thing you're doing, then that mismatch is something that you should be, I think, grappling with. So as I got older, I think that in a more directive or intentional way, that passion began to emerge for me. I did develop, in the middle of my career, a growing passion to have an impact in a more specific way. And what I wanted to do was to have some impact on the overall health of my fellow citizens. I began to see big issues that needed informed expert guidance. For me, a big area became the growing problem of obesity in America and its cancer-related consequences. And I don't think you can't only confront that one-on-one. There are public policy issues that have to be raised and thought about and maybe adjusted. And to do that, you have to have a stage, a context to have that influence. And that, in part, is what drove me towards ASCO. It was the one place where I could spread my influence or have more influence in a supported and constructive evidence-based way, which is really what I was passionate for. I want to go one half step further. In this regard, the passion is not purely emotional. The passion is emotion fueled by evidence.
We talked about a number of different successful characteristics, mentorship and intention and passion. From your experience, Dr. Hudis, what are some markers that you can recognize or measure per se that you've seen?
I don't know if there's any one thing. There isn't one personality. But I don't know if this will answer your question, but what I look for is a balance of satisfaction and frustration with the world, with the conditions, with the progress that you're making, whatever it is. And what I mean is you have to have enough satisfaction to feel comfortable that you're doing the right thing for the right reasons and that you're making some progress towards your goals. On the other hand, you have to evidence some degree of frustration with the current reality, whatever it is, such that you are motivated to do something about it and to throw yourself into it. You have to be optimistic that change is possible and that everything you see isn't going to simply remain that way regardless of your efforts. So for me, that mixture of satisfaction and frustration, somewhere that balance is what I'm always looking for. Maybe the right answer is I'm just looking to see a little bit of both of those things.
I wanted to ask you a question about research, Dr. Hudis. You've done a lot of research in breast cancer, on the treatment strategies, on prevention, as well as you mentioned. For a resident, for an intern who is starting to understand the importance of research, what is your advice to them?
This comes back to the mentor. I don't think in most cases that an early career investigator of any kind is likely to have the breadth of knowledge for the for the disease and for the greatest gaps in care or treatment or biology to be able to necessarily identify the most pressing problems and deliver results. So that's a really wordy little paragraph there. What I'm saying is you need a mentor. That's the absolute fact there. That mentor should be able to help you learn enough about the disease and the context of it so that you with them can identify a problem you could solve. And ideally, you want two things out of early career research, at least as a translational and clinical investigator. You want to learn methods of research so that you conduct studies that are ultimately well done, effective, believable, and advance the field as a whole. And the second thing is, of course, you want to learn the specifics about the area of science that you're working in. Those are two different things, research methods and research itself. So I think it comes down to mentoring. I think the other big issue is time. It's hard, borderline unrealistic for most residents to be thinking really about a productive and effective research program. If that's your passion, you should be looking for training programs that call that out as a value and have structures in place to support it. arguably programs that run longer than the typical one, programs that have time allotted for laboratory or translational research blocks, whatever it is. But that's the way I think you have to think about it.
Dr. Hudis, if there were one message that you'd like to give to residents today from your personal and your professional experience, something that they could remember to be successful not only in clinical practice or medicine, but also in life, what would that one thing be?
At the risk of repeating myself, I think that in the end, it is a remarkable privilege to be allowed into a patient and family's experience confronting illness. And I think that we should recognize that gift, that privilege for what it is, and we should never lose sight of the requirement we bear to be caring, to be empathic, to be engaged. Everything else is a tool. What we deliver to patients is results and hope. Those two things. To do that, we have to take advantage of what the world offers. It's very technology driven. It's easy to be distracted by all of that. But at core, you have to be in medicine because you want to help people.
Wonderful. Dr. Hudis, thank you so much for your time and for being so gracious to grant this interview. Thank you for joining us for another episode of The Medicine Mentors. It was such a wonderful opportunity to spend time with Dr. Hudis. What I love about Dr. Hudis is that he has an almost daunting level of professional prestige, but yet he is extremely relatable and generous in sharing his presence and knowledge. We hope you took some of Dr. Hudis' experience to heart. Please subscribe to stay updated on our newest episodes featuring the insights of top physicians. And please do comment about your experiences to keep the conversation going. Thank you again for joining us for this opportunity to learn from the masters of medicine.